हेलो एवरीवन, वेलकम यू ऑल इन आवर यूट्यूब चैनल लर्निंग रेडियोलॉजी। तो स्टार्ट आवर टूडेज टॉपिक। तो आज के वीडियो में हम बात करेंगे CO2 एंजियोग्राफी के बारे में, मीन्स कार्बन डाइऑक्साइड एंजियोग्राफी के बारे में हम बात करेंगे। इस एंजियोग्राफी में हम कार्बन डाइऑक्साइड का यूज़ करते हैं एज ए कॉन्ट्रास्ट एजेंट और इंटरनेशनल रेडियोलॉजी के अंदर प्रोसीजर हमारा किया जाता है। जो BSc और MSc के बच्चे हैं उनके सिलेबस में भी होता है हमारा CO2 एंजियोग्राफी, उनके सिलेबस में भी होता है और एग्जाम में पूछा भी जाता है कि किस तरीके से एंजियोग्राफी का प्रोसीजर करते हैं। तो इस प्रोसीजर में हम बात करेंगे इसका इंडिकेशन, कॉन्ट्रा इंडिकेशन और पेशेंट प्रिपरेशन, टेक्निक, प्रोसीजर कैसे करते हैं, क्या क्या कॉम्प्लिकेशंस होते हैं, क्या आफ्टर केयर्स होते हैं। सो चैनल पे लास्ट तक बने रहिएगा, लास्ट तक देखिएगा। अभी तक आपने अगर मेरे चैनल को सब्सक्राइब नहीं किया तो सब्सक्राइब कर लीजिए, क्योंकि हम रोज नए नए वीडियोज लाते रहते हैं आपके लिए। तो चलिए लेट्स स्टार्ट दिस टॉपिक। CO2 एंजियोग्राफी मीन्स we also use CO2 as an alternative contrast agent to iodine contrast material. Normally we use iodine contrast material for a angiography or a procedure, and for a alternate we use CO2 gas as an alternative contrast for the procedure, and the gas produce negative contrast because it have a low atomic number, low density as compared with the surrounding tissues. Let's look over a history of our CO2 or a procedure. CO2 procedure means it is used to diagnose the pericardial effusion in 1950s. At the time of 1950s, the procedure was used to diagnose pericardial effusion. We use intravenously 100 to 200 cc CO2, causes no change in the vital sign. At the time of 1970, CO2 used as a intra-arterial contrast agent. At the time of 1980, in a DSA, we use CO2 as a contrast material. The physical properties of a CO2, like a colorless and odorless, they have no color, they have no odor, means they have no any type of smell from CO2 gas. CO2 is approximately 20 times more soluble than oxygen, and CO2 bubbles completely dissolve within 2 to 3 minutes. Compressible during injection and expand in the vessels as it exits the catheter. It is lighter than the blood plasma, therefore it floats above the blood. Approximately 400 times less viscous than ordinary contrast medium. Means the contrast media we have used in a procedure, that from this contrast media, CO2 is a 400 times less viscous than ordinary contrast. Advantages of CO2 are like non-allergic, non-nephrotoxic, unlimited total volumes, low viscosity, inexpressive, minimal or no discomfort. In case of a disadvantage, like it's require unique delivery system, because when we deliver CO2 during the procedure, this have a unique other delivery system to deliver the CO2 during the procedure. It is invisible, that potential for the undetected contamination currently not suggested in cerebral vessels. Bowel gas can interface with abdominal images. The contraindication for a CO2 angiography are like no absolute contraindication to the use of CO2 exists. Do not use CO2 in a vessels above the diaphragm because the risk of intracerebral propagation and a stroke. When we use CO2 for a procedure, then the risk of intracerebral propagation and a stroke. And use CO2 with a caution in a patient with pulmonary insufficiency or a pulmonary hypertension, because diagnostic dosage of CO2 can increase the pulmonary arterial pressure. That delivery method, we use delivery method like closed bag system, and another one is handheld syringe. Means CO2 can be delivered into the vessels by using 30 to 60 ml handheld syringe. Another one is closed bag system. In case of CO2 cylinder, the delivery system should be filled with 99.99% laboratory to grade CO2. Cylinder is supplied with highly pure gas and cylinder have a valve, regulator, gas gauge, metal diaphragm with the regulator set at 18 psi. This is the plastic bag system, and this is the handheld syringe method to deliver the CO2. In case of handheld syringe method, we are using a syringe and then fill it directly from the CO2 cylinder. Then after, we do not aspirate CO2 into the syringe because this technique may cause air contamination. And the handheld syringe method also reduce its pressure to atmospheric level by quickly opening and closing the stopcock. Another method is a plastic bag system method. Plastic bag system method is very useful when multiple injections are needed. And plastic bag system, in the plastic bag system, fluid collection bag is fitted with a CO2 and it is connected to the reservoir port. And this system has a airtight connections with the check valve and the injection port and the catheter port. And the bag should be filled with emptied with CO2 and 3 times therefore the final filling to remove the air from the bag. These are the plastic bag system. Images of a plastic bag system are on the syringe system. Patient preparation for the procedure, like no specific patient preparation required for CO2 angiography. And the standard preparation for the catheter angiography is used, and a patient with a history of allergy to contrast material do not require the steroid preparation. This is the system which we use taking oxygen, taking carbon dioxide into a syringe, and after syringe we inject into the patient. Technique of CO2 angiography are like we use 30 to 60 ml of CO2 are injected into the aorta or inferior vena cava via a pictal catheter. Less volume is used for selective injection, and a huge catheter with one-sided hole. Injection are performed 2 to 3 minutes apart. Patient should be in a supine, and the injection must be made below the level of the diaphragm. Case of CO2 angiography image processing, CO2 angiography can perform at 2 to 6 frames per second using DSA equipment, and a DSA software with the angiographic inversion and image summation or a stacking. This is stacking method, a DSA. Means we get this image, we get this image, and we get this image, and after getting 3 images, joining all the images, and we get a new images. Diagnostic applications for a CO2 angiography means they are useful for the following arterial procedure like abdominal aortography, iliac arteriography, run-off analysis of the lower extremities, renal arteriography. Useful in some venous procedure like venography of upper extremities, inferior vena cabography, hepatic venography. Intervention like balloon angioplasty, stent placement, embolization. They are the images when you use CO2. Like first one is the right side, right renal artery with a mild stenosis, and a celiac and a superior mesenteric artery filled nicely because of their anterior origin. There are the images. There are case study of a different patient, and this image shows the mesenteric CO2 DSA with a small bowel bleeding, shows the extraction of a CO2 gas bubbles. This image shows and this image also shows the CO2 guided stent placement of the right renal artery stenosis. This image shows the CO2 aortogram for abdominal aortic aneurysm. Other conclusion of this topic are like CO2 is this angiography is safe when used appropriately, and CO2 has a unique property as a contrast agent. It can be used alone or in addition to other contrast agent. It is very useful in the both diagnosis and treatment. Thank you. These are the references for the slides. Thank you. Like the video, comment on this video, subscribe the channel. We will meet in next video. Okay, thank you.